Hi, Dr. Mark Burhenne here of AskTheDentist.com. So here's a burning question for you. Should you be discussing oral sex with your dentist? I know that's a little bit of a shock and maybe a little uncomfortable for you to mention to your dentist, but I would recommend that you have that conversation. The reason is this: HPV, the human papillomavirus, now supersedes or is now the main cause for oral cancer. It used to be, back when I was in dental school, and we were trained how to identify the high-risk group, pretty easy to do, the people that chew tobacco, the smokers, and the heavy drinkers. But now it's the people that have had, according to some researchers, it's the people that have had oral sex with more than 20 partners. Again, this is a line drawn in the sand by researchers. It's something you have to kind of figure out for yourself. But talk to your dentist about the connection and how it can cause oral cancer. It's a serious thing. And if it is not caught early, it can kill you. So the dentist can do an oral cancer exam. We're trained to do it. Unfortunately, I don't think it is possible to get a complete oral cancer exam at the dental office. I think the better exam, if you're a patient that needs to have this done, would be at the ENT, the ear, nose, and throat. They would basically get your nose or throat numb and send a camera down there and take a really, really good look, because that's where a lot of this cancer is found, at the base of the tongue, the oral pharynx. I mean, tissues, anatomical parts of the throat that can get cancer. And I can't see that as a dentist. So I think it's a false sense of security that you think your dentist is giving an oral cancer exam every 6 months and that you're fine. So have this conversation with your dentist, find out more about it. There is one other test which I am beginning to think needs to be routine, and that is a test that you order out. Your dentist brings it to you. You swish create some saliva in your mouth, swish into it and spit into a test tube, and it gets sent off. And that is like a blood test, essentially. It's looking for a marker for this cancer. And I think that's something that you should consider. So if you think that you've had, and again, this is a line drawn in the sand by some Harvard researchers, if you think you've had oral sex with more than 20 partners, ask your dentist about this test and have it done. And this will give you some peace of mind. So in conclusion, have a discussion about oral sex with your dentist. It may save your life.